Beautiful people, welcome back to my channel. And even though I am not in scrubs, this is a nursing video, and in this video today I want to wish all of the new nurses congratulations on entering the profession. Some of you have not yet taken your NCLEX. Well, maybe most of you haven't yet taken your NCLEX because it's only June 5th and some of you just graduated last week. So maybe you'll be taking your NCLEX in the next few weeks, and I know, I have faith and trust that you will pass on your first attempt, and then you will be ready to rip and run those floors because the OGs like myself, we are tired, okay? So we are welcoming you to the profession. In this video today, I want to talk about some things. I just want to make you aware, kind of give some tips, maybe a little bit of advice to the new nurses, the nurse graduates entering the profession. So presentation is everything. So you know, like for clinical, how they gave you an entire guideline on how you had to show up looking the part. Like when I was in nursing school, the expectations for clinical appearance was really a big deal. Our scrubs had to be ironed, the white had to be sparkling, there's this certain color underwear we had to be wearing. It was very meticulous. Now, as a new nurse entering the profession, you don't have to be as meticulous as the nursing school guidelines, but I want for you guys to focus on your appearance. I want you to show up to work looking the part, looking like the professional that you are. Make sure your scrubs are ironed, you're neat, your hair is combed. Gentlemen, make sure that beard is nice and neat, the hair is combed, cut. Please do not show up to work looking scraggly. Do not show up to work looking like you just rolled out of bed, especially being that you're new to the profession and you're new on the job. You want to make a good impression, and just always keep in mind that first impression is the lasting impression. Whenever you go to work, if you look a mess, if you look like you didn't put much into your appearance, your colleagues will be talking about you. And to make matters even worse, your patients are seeing you, and also their families will be present. And if you don't look right, if you don't look the part, that, believe it or not, trust diminishes. Your patient will be like, well, if you didn't even care about your appearance coming into work, how can I even trust you to take care of me? So your appearance is everything. Please, please, please show up looking. I want for you to keep in mind that you are a novice. And I don't mean this in a bad way. Obviously, I know that you worked hard and that you've acquired a certain amount of knowledge from sitting in the classroom and attending clinicals at various clinical sites, but you're still a novice. Many of you in your nursing school programs may have heard of Patricia Bennett. She is a nursing theorist, and her theory is called the novice to expert, meaning that after a certain amount of years and exposure to the profession, you work your way up from being a novice to proficient to competent and then like to expert. Now, don't quote me if I had them in the right order, so you guys can look her up. Like I said, her name is Patricia Bennett. But as a new nurse, you are a novice. Do not feel bad. Do not get down on yourself because you did not make the clinical connection. You weren't able to think as fast or come up with a solution real quickly. The reason why your colleagues will be able to do that is because they have the experience, not because they're smarter than you, not because they went to a better school than you. It's simply because they've been in the clinical setting. Nursing is more about experience than it is about the education that you received. Once you're in the clinical setting and you spend time there, as time goes on, you will build a certain set of knowledge and skill set. So don't be too hard on yourself. Like I said, if you don't catch on really quickly, you're still a novice, but you're going to get there, okay? Now, to piggyback on that second piece of advice, being a novice, don't be afraid to ask questions. Ask, clarify, double check. Do not consider the fact that other people might say, oh my goodness, how many times do I have to tell her this? Or how many times did I have to tell him this? It doesn't matter, okay? You need to double check. Be okay with asking questions. There is no such thing as a stupid questions. It is better to ask the question than to go in there assuming that you know what you're doing and make a mistake and mess up. Ask questions, okay? I can't stress how important that is. Clarify and ask questions. Sometimes you think you might understand something and then you go to do it and you realize, you know what? I don't know what's going on, but I need to get it done. No. Stop. Ask your preceptor. They're a preceptor for a reason. Ask your preceptor. If your preceptor is acting as though they're giving you attitude or giving you pushback, you can also go up the chain of command. You then have a charge nurse. Double check with your charge nurse, but always ask your preceptor. In line with what I just told you guys about being a novice and asking, this is a big one, maybe the biggest one. Do not perform any task, any skill, any intervention that you've never done before, that you don't feel comfortable doing, that you've never even heard of before. And the reason why I say that is because sometimes as nurses, we feel obligated to get things done and we don't want to say no. In nursing, it's almost as though saying no is a bad thing. Well, no. Let's get rid of that mindset, get rid of that thought. Saying no can be a very good thing, okay? Especially as a nurse, especially when you don't know how to do something. Let me give you an example. Like, you might be a new nurse, or you are a new nurse. You're in your brand new blue scrubs, navy blue, and you're in the patient's room doing something. A physician, a provider of some sort walks in and asks you to do something. Press that button on the ventilator, or do this, or whatever the case is. Get this, pull on this tube, turn that dial, wipe it down with alcohol. They ask you to do something that you've never done before. Just because they are the provider, do not be intimidated by that. It's okay to say to them, I've never done this before. I am actually new. I'm a new nurse on the floor. Let me go get my preceptor and bring her here so that way you can explain to her what it is that you want. Or I can go ask her and tell her what it is that you want, and her and I, or him and I, will do it together. Do not feel obligated. Do not feel pressured. Do not feel inclined to do something that you've never done before, especially if it's being delegated to you by a provider, especially a physician. Because I know it as a new grad, I used to kind of be like a little bit terrified of doctors. So it wouldn't surprise me if you felt pressured into doing something. But please, 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 if you've never done something before, wait for your preceptor to be there. On the other side of that, let's just say a task needs to be done for your patient, and you say to your preceptor, hey, I checked the orders. An order came up to flush the tube with 10 cc's, clamp it, and then release it. I don't even know how to flush the tube. I've never done it before. And your preceptor explains to you verbally how to do it. But let's just say you've never done it before. It's okay to say, I hear the verbal explanation, but do you mind coming with me to do it? That way you can make sure that I'm doing it right. So in the future, I'm more comfortable doing it. It's okay to say that. Do not perform any tasks that you do not know how to do. Ask for your preceptor to be present, because if you do, go ahead and perform a task. And let's just say you caused that patient harm. Guess whose fault that is? It's not your preceptor's. It will fall on you. Remember now, you have that brand nice, shiny new license. It will fall on you. So just keep that in mind, okay? And take that with you all throughout your career, no matter what setting you're in. If you've never done something before, ask somebody to come with you, have them show it to you, demonstrate it, and then if you feel comfortable doing it, by all means, go ahead. As a clinical instructor, whenever I would kind of give my students a talk on nursing, I would always advise them, especially my students who were graduating the end of the semester, I would encourage them that when they start on their new jobs, they get a journal and kind of journal their work days. For example, I'm not saying that you have to include any HIPAA information or any information specific to the patients that you cared for, but I think it's important for nursing students to for new nurses to kind of keep a journal of the day. The reason why I say that is because one thing my uncle taught me growing up is that never depend on your memory, because your memory will fail you every single time. And as a new nurse, things can happen. You're working with a preceptor. Sometimes you and your preceptor might bump heads, or sometimes there might be some miscommunication. And later on down the line, if you need to repeat the story or kind of give details on the situation that happened, you're not going to remember. So as a new nurse, I urge you all to kind of jot down what happened for the day. For example, you can jot an example of like a journal entry would be something like, arrived today at 6:45, punched in at 6:59. My preceptor Tracy called out. They assigned me to work with Julie today. Julie had only been a nurse for 8 months on the unit. Today we were assigned 3 patients. This is what I did today. Or the patient family member came in saying that his watch was here and the watch disappeared. However, when we assumed care of the patient, there was no watch present. Whatever, that's just an example. Like, keep a journal, okay? You'll be happy for this piece of advice because you never know what can happen. While we're on the topic of journaling and writing, your clinical paperwork. When you first start on your unit, the educator, if you're in a residency program or even if you're not in a residency program, your educator will provide you more than likely with a binder with a stack of papers in it. Skills checkoff list. Did you do this? Did you do that? Please keep on top of your paperwork. It is not anybody else's responsibility to track your paperwork and sign it off for you. If you are completing tasks and skills, have your preceptor sign it off that day. If, let's just say, she's like, oh, well, I'll just sign it all off at the end or sign it all off for tomorrow. Make sure that you're initialing put in your initials and the dates for all of the things that you've completed. So that way in the end, you can say, no, on July 7th, I was able to mark off the chest tube, or on whatever, June 13th, I went ahead and I did my first PIV insertion, peripheral IV insertion. So just make sure that you're on top of your clinical binder and your clinical paperwork, because at the end of your orientation, you will be responsible for submitting that back to your manager or to your educator. Moving right along. So you get on the unit, you're a brand new nurse, and this is something I've always struggled with when I see other nurses not be warm and welcome that new grad nurse. I always go out of my way to speak to the new nurses, even if they're experienced and they're just starting on the unit. I always introduce myself. I say to them, you know, hey, my name is Kendra. I work in the float pool. I'm here like maybe 2 times a week. If you need, which patients do you have? If you need any help, call me. I have these 2 rooms back here. I always make it my duty to do that because it helps people to feel welcome. Unfortunately, not everyone shares that same sentiment as I do. But as a new nurse on the unit, make it your business to introduce yourself to people. Sometimes your preceptor may not introduce you to your other colleagues, and that's part of preceptor training that needs to happen. I think instead of just like choosing nurses and saying, hey, we're going to give you a new nurse, or hey, we're giving you a nurse to train, they need to train the preceptors on the proper way of even introduction, because new nurses don't always get introduced, and then they have to like be awkward if they walk into the break room and there's a colleague sitting there. They don't know how to like go about saying hi or whatever the case is. But new nurses, when you get on the unit, own your position. You belong there. You've passed your NCLEX. You got the job. Own your position, own your space. Introduce yourself. Hi, my name is Kendra. I'm the new nurse. I just started last week. What is your name? Okay, glad to know you, because just in case I might need a little help, if my preceptor is not around, I may need to call you. Whether they respond in a kind manner, in a short manner, it doesn't matter. You introduced yourself and you're setting the tone just in case you might need their assistance. Because there might be a time where your preceptor goes to lunch and leaves you on the floor, or your preceptor might step away to go help someone else, and then you need immediate assistance, and that's the nurse that you'll have to turn to say, hey, such and such is not here, but can you help me do this? Or what do I do about this? So just introduce yourself to your colleagues. Now, okay? I'm going to get ready to wrap this up very shortly. And I'm leaving you with this last piece of advice, tip, whatever you want to call it. Take your breaks and your lunches. Do not, for any reason, sacrifice your break, sacrifice your lunch. Legally, you have to take your breaks. The federal government says that. It's in the labor laws. You cannot be denied your breaks and your lunches. So in a 12-hour period, usually you get 2 15-minute breaks, and then you get a 30-minute lunch break. And why is it even 30 minutes? Can we please talk about that? It needs to be an hour, because 30 minutes, you can't do nothing in 30 minutes but heat your food up, sit, eat it, get it right back up, and head back on the floor. So we need to fix that. But anyway, I digress. Your 15-minute break, your first 15-minute break should be sometime in the morning for you to actually get maybe some coffee and some breakfast, whatever. If you're a breakfast eater, your 15 minutes should be for that. And then your 30-minute lunch break, you can combine it with your last 15-minute break and take an entire 45-minute lunch break. That's what most nurses do. But take your breaks, and take your breaks in a timely manner. This whole idea of working to try to get everything done and then leaving your breaks and your lunch for last is not good practice. You have to take care of yourself first, because if you don't take care of yourself, how can you take care of the patient? So for example, some preceptors act as though everything has to be done within that moment. That is not true. And those of you that are precepting, please stop making those new grad nurses feel as though they have to get everything done within that moment, because if they don't do it, they're not adequately time managing or prioritizing. And that's a topic I'm going to discuss in another video, the whole idea of time management and why I think that's a huge form of gaslighting for nurses. But anyway, your preceptor might not say to you, go on break, go on lunch. At times, as a new grad nurse, you have to say to your preceptor, okay, I just took Mr. Such and Such off the bedpan. I know my documentation is a little bit behind, but I need to go eat lunch. When I come back, I'll start up again, okay? Don't sit there and work till 4 or 5 o'clock in the evening, and then by that time, you're frustrated, you're flustered, you're hungry, you're hangry, but you can't do anything about it because you're trying to keep your job. And then you go on break, you scarf your lunch down in 10 minutes and you're back on the floor. Please don't do that, okay? You're entitled to your lunch. You're entitled to your break. Take your full time. The work will always be there. The patient is not going anywhere. As a new grad nurse, you might have to stay behind a little bit later to finish up your documentation. 10, 15, maybe even 20 minutes, maybe even an extra 30 minutes I've seen. I mean, that's not really liked. It's frowned upon by the institution, but it is what it is. Take your breaks and you take your lunches. If you take anything away from this video, take your breaks, take your lunches. Ask questions. Don't do anything that you're not comfortable doing or that you've never done before. Remember that you are a novice, and there's nothing wrong with being a novice. We all start somewhere. I was a novice. I considered myself a novice for at least 2 years, because it wasn't until after 2 years I felt like, oh, this is what that means. I think I know what I'm doing. Anyway, guys, I'm going to end it right here. Thank you all for watching. Subscribe to my channel. Leave me some comments. Leave me some suggestions. And I will see you all again in the next video. Thank you for watching.